Hello friends, so finally AIIMS exam is done. As usual, a surprise paper with a new pattern that they have introduced, video questions. Getting a lot of queries about whether this same pattern will be repeated in NEET or not. See, that is what an entrance exam is, that they are always unpredictable, but ultimately you have a question, you have got 4 choices and you have to pick up an answer. And always remember that the paper is not only for you, it is for everybody. So if it was a surprise, the surprise was there for everybody. Okay, so no need to get too much apprehension on what will be there in the NEET. We'll try our best to prepare you even for the worst possible situations. Coming back to the AIIMS paper, so we are done with the collection of the paper with the most authentic answers and the choices. See, the biggest challenge that happens in an MCQ paper is to get the right question along with the right choices, because all that matters is that what was the exact language of the question, and that's a typical for the AIIMS paper, that the slight change in the language of the MCQ changes the answer. Okay, so continuing with the trend, we will be discussing the entire paper with you, and I'll be discussing the radiology part with you. So what we have done this time is that we all know that in AIIMS we get a lot of integrated questions which are not one of particular subject, and everybody claims that so many questions from one subject, so many questions from one subject, because that we know that there will be a lot of overlap between radiology and orthopedics, anatomy and physiology, anatomy and medicine and pathology, surgery and orthopedics and lot. So we are working on that, and we will be trying to discuss one question at one place, so that to provide the most authentic answer to the students along with the best possible choices. So I will try to show you the best possible choices and with the best possible explanation of the question. But again, if somebody has a query about those who have appeared for the exam, then you can always come back to us and reframe the question, and we will get back with the best possible answer. Okay, so starting with the one fact based MCQ that we got, empty thecal sac sign on MRI is seen in. Okay, so a fact based MCQ, arachnoiditis, discitis, vertebral osteomyelitis and tethered cord syndrome. Now again, if you remember our discussions of the classes, I have always talked about that it's the easiest thing that you can do is that if you know the correct answer of the MCQ, it's very easy for me to tell you the right answer for this MCQ, which is arachnoiditis. But now see, let's say that the student has never heard about this particular MCQ, then how to pick up the answer? I always believe that how to pick up an answer if you don't know the correct answer. So first let's see the explanation of this. So I hope all of you can appreciate that this is a T2 weighted MRI in the transverse plane, and all we can, if I'll just mark some of the structures here. If I mark some of the structures here, I hope you can see that this is the vertebral body, whereas these are the posterior elements, and in the center that you could see is the thecal sac, now which is filled with CSF, and that is why it is appearing so white. Now in this white you can see these black dots. Okay, these are the black dots which are the nerve roots. Okay, so what is this section is taken at a lower level, almost at an L4 level, now where these nerve roots are seen separately, because what happens, we know that the spinal cord ends at L1, L2, the lower border of the L1 or the upper border of the L2, and after that what you see are the chordae equina nerve roots. Now they all traverse through the neural foramina. Okay, now what happens in an arachnoiditis, now there is a clumping of these nerves, and if you see the clumping of the nerves, see this. Now what is happening is all the nerves are clumped in the periphery, so it looks like that the sac is empty, which is called as an empty thecal sac sign. See the normal thecal sac and see this, and that has been described as an empty thecal sac sign. On the other hand, if I'll show you the other, now this is what is actually called as a tethered cord. Now what is a tethered cord? Tethered, the cord is tethered. Normally we know that in the pediatric patient the spinal cord is pretty down, and as the child grows the spinal cord moves up and the final adult level is at L1, L2. Now in a tethered cord, the cord is tethered lower, it is attached, usually it is associated with a lipoma or maybe with some other congenital disorders. So basically the cord doesn't ascend up, and you can see that the cord is not ending at the lower border of the L1 and L2, and it is going further down. Okay, now this you can easily appreciate on a sagittal scan, whereas on a transfer scan you will see that there is a central spinal cord even will be seen at the border of, at the L3, L4 or L5 level, because usually it is tethered at the S2 level. So that's a tethered cord. Whereas this is the vertebral osteomyelitis. As the name says, vertebral, it should involve the vertebra. So there is a vertebral osteomyelitis. As you can see, the altered signal intensity in the two contiguous vertebra. Discitis, we all know that this is the intervertebral disc, should involve the disc. Okay, so that's the explanation. But let's go back and let's see what I should do in the exam, even if I don't know the correct answer. I was talking to a few of the students and I am sure that they will be getting very, very good ranks in the exam. So now what they told me is the beauty is that what they realize is that what is called as a the nota rule. I hope if you see this question, now you can easily rule out vertebral osteomyelitis and discitis in this particular question, even if you have no idea about this particular answer. So even you have no idea, you can still rule out the discitis should something that is involving the disc. Empty thecal, we all know thecal means the spinal canal which is filled with the CSF. So it's something to do with that. So discitis and vertebral osteomyelitis are the two options that I feel that any student can rule out in this particular option. So left with arachnoiditis and tethered cord. So basically it is not a 4-option MCQ, it is only a 2-option MCQ. Now you will have to play with the words. Tethered, it's an English word, we know that the cord is tethering. Empty means that sac is empty. So if you would have applied your brain, probably you would have been able to pick up the correct answer. So my only suggestion in this, that even if the question is slightly away from your normal thought process or a normal thinking process, still you will be able to pick up the correct answer if you just put some brain to the choices. And most of the radiology questions were like that in this particular paper, and I feel not just radiology, it is the most of the questions which are like that. Okay. Coming on to the second question, that was straightforward, a simple first 20% category question where I don't think that there is nothing great. Which of the following investigation does not have ionizing radiation? Okay, so we all know that the common ionizing radiation that we use in the radiology are X-rays, and which are used in radiography, angiography, CT scan, whereas an MRI does not give any ionizing radiation. That is usually the first line of my class, and I feel not just my class, for even of any radiology class, that will be the first line. Okay, so that was a very, very simple question. I don't think it will decide rank. Anybody will be able to answer that. But please remember, few more questions that you may get in the upcoming NEET. Now you also need to know, apart from the X-ray, which other ionizing radiations are used in diagnostic procedure. Gamma rays. Okay, so all those nuclear scan what we read, they all using ionizing radiation, but they are using gamma rays. This you have to remember for the future exam. Okay, now important examples of gamma rays: PET scan, SPECT scan, bone scan, thallium scan, scintigraphy, MUGA. All these are examples of nuclear scans. Okay, so make sure they are also using ionizing radiation, but not X-rays, gamma rays. Okay. What is the diagnosis? Yeah, so this is one image which is going around. So as for the students, this was the image that was given to me by the students. Now if this was the image, that's a classical pneumoperitoneum. There is no doubt about it. Okay, so you can see air under the both dome of diaphragms. So on the left side, we may have a doubt whether it is because of the fundal bubble or a free air, but air under the right dome of diaphragm is a definitely free air, and which is pneumoperitoneum. But coming back to the option. Now, one of the student told me that why AIIMS will give such a simple question, and then you start thinking in some different lines. Okay. Now the point is, always remember in MCQ paper that you can't mark the answer like that. That if it's AIIMS exam, it will always be a difficult question. If it's a DNB, it will be an easy question. No, it is not like that. Every paper has got a mixture. Some questions will be pretty easy, some questions will be pretty difficult. So never think that if it's an easy question, it cannot be in this particular exam. So if this was the image, this will definitely be a pneumoperitoneum. Okay, but if this was the image, then this is a pneumothorax. As you could see, now the air is in the pleural cavity, and you can appreciate it from the left side there are vascular markings on the left side, where there are no vascular markings on the right side. Whereas if this was the image, now you could see this time the bubbly lucencies, air lucencies are entering into the thoracic cavity with a direct continuation with the abdomen and displacing the heart to the right side, which is a congenital diaphragmatic hernia, which was, I think, one of the choice. Okay, the biggest confusion that few students had were diaphragmatic eventration. Okay, now because one student told me that the diaphragm was pretty up. Okay, so please, diaphragmatic eventration will be usually unilateral. Okay, will be usually unilateral, and the second is the bowel loops contain air in that. There is no free air. Now it becomes sometimes slightly difficult at an undergraduate level to differentiate whether the air is actually present in the bowel loop or it's a free air that is present. But I feel that if the examiner wants to show you the free air, most of the time it will be towards the right hemidiaphragm that they will be showing you. One. Second is, if you see the free air carefully, then you will be seeing, because ultimately it will be somewhere in a bowel loop, so you will be seeing the bowel lines, or you can see that these whitish line, which can help you in identifying that this air is not free air, it is basically present in a bowel loop. Okay, so one was usually it's a unilateral thing, but otherwise I do agree that sometime your brain might confuse the two, particularly if it's a unilateral problem. But I think as per the review with the students, that was a case of pneumoperitoneum. Pneumoperitoneum is one of the commonest image that we get in most of the MCQ exam, and it's a potential question for the NEET also. But please remember, for the NEET, a fact-based MCQ, if somebody asks you what is the preferred or the most useful imaging investigation to diagnose pneumoperitoneum in the modern radiology practice, then it's a CT scan. CT scan is considered to be nowadays one of the most useful imaging investigation, both for the diagnosis of intestinal obstruction as well as pneumoperitoneum. Okay. Now what is the diagnosis? So there were 4 choices. There was an image that I'll show you in a while. Cervical rib, spondylolisthesis, C5/C6, fracture left second rib, and costochondritis. Now let's see this image. It was a radiograph. Now we will see the images in a while, but what I will think from an undergraduate student point of view, it was an X-ray of the cervical spine that was shown to you, with some part of the thoracic was also included. Now just think about it. If it's a frontal X-ray, it cannot be a spondylolisthesis, because we know it's an anterior or a lateral migration of the vertebrae. So this cannot be a spondylolisthesis. Costochondritis, it's not a radiographic diagnosis. So these are the again 2 options that we can easily rule out. Then we are left with either it's a cervical rib and it's a fracture left of the second rib. Now fracture left rib was easy to exclude. You all know that by definition fracture is the break in the continuity of a cortex. So if the cortex was discontinuous at some point of time, I probably would have thought of a fracture. Cervical rib, we know. Now the thing is learn how to see the cervical rib. So if I show you, now that's the image that I could predict on the basis of the review from the students, that somehow this kind of the image was there. So that looked like a normal rib. But let's go back to the normal rib. That's how the listhesis looks like. You could see that this is the anterior migration of the C5/C6, which is an anterolisthesis of the C5/C6. Okay, now see this. Now see what is the difference. Now if you see that, we know that the ribs, they articulate with the transverse process, and the biggest point about the transverse process that can help you is a thoracic rib or cervical rib, that in this the thoracic vertebrae, the spinous process points up. As you could see, it points up. So all these ribs that are coming are the thoracic ribs. On the other hand, see this image. Okay, now all these ribs are thoracic rib, whereas if you see that the transverse process of the cervical vertebra, it points down. Okay, so the rib, if it is pointing down, this will not be originating from the thoracic vertebra, it is originating from the cervical vertebra. Okay, now so the only problem was probably that the second fracture of the second rib, you could have easily seen, and the cortex is intact, then this will not be a fracture. So this was most probably a cervical rib that was shown. Okay, yeah, this was one of the confusing image that was shown to the students in the exam. Now I could not get the 4 choices. So all two choices where the students were most confused were whether it was a myelography or an angiography, and it was a cervical spine lateral X-ray where you could see some white structure between the vertebral body and the spinous process. Now we all know between the vertebral body and the spinal process you have got the spinal canal, and if you see white structure in the spinal canal, this has to be the contrast. So this was the contrast in the spinal canal, and if you have a contrast in the spinal canal, this procedure cannot be an angiography, this has to be a myelography. Okay, so these were the questions that were there in the exam, friends. But as please never compare the two exams. Now AIIMS, this is the always a trend that I have seen it, that the questions that they ask in the exam, in particularly in the AIIMS, they are not always the direct questions. Now they ask these questions in a way where if you apply your brain along with the knowledge, you will be able to definitely solve them. But NEET is definitely different in that particular manner, where we get more of a predictable questions in a right manner, that what will be asked and what, and most of them they are slightly atypical but direct question. Coming on to one more point that I want to raise here is that we got some of the queries about wrong questions that were there in the AIIMS. So though I will not be discussing that, that will be discussing in the orthopedics section, about one question where there was an option as a giant cell tumor and an osteoclastoma, and there was one physiology question where was an option as a prolactin and an only prolactin. Okay, so ideally now we all know that GCT and the osteoclastoma are the same, and what to do in these cases. So please remember, it happens with everybody. It happens in almost every exam. If I recall my own days when I appeared for the Delhi PG 2007, I remember that in my own exam there were two questions like that, and I still can't forget that. There was one question where option number A and option number B, I don't remember the exact options, but option number A and option number B were exactly same. Whereas and that was the answer. Okay, and there was one question which is a typical question that sometime I discuss in the class also. It was a obstetric question, and the question was, which of the following is a contraindication to give magnesium sulfate to an eclamptic patient? Which of the following is a contraindication to give magnesium sulfate to an eclamptic patient? Now we all know that the three important contraindication or which signs suggest magnesium toxicity is the delayed tendon reflex, heart, the respiratory depression, and renal failure. So renal failure is basically measured by the urine output, and respiratory depression is by the respiratory rate. Now the point to be noted in my question is which of the following is a contraindication of giving magnesium sulfate to an eclamptic patient? The first choice was absent knee jerk, second choice was respiratory depression, and third choice was urine output less than 30 ml per minute or per hour. I'm just confusing it, whatever. And the fourth choice was heart rate more than 100. Now the point to be noted here is, now what is the right answer for this? So I will say A, B, C, all three are correct. Okay. Now many students said, no sir, the earliest sign of the magnesium toxicity is the delayed tendon reflex. So answer should be delayed tendon reflex. Whereas these two signs are the advanced magnesium toxicity. So that means they are more important a contraindication. Now this happens with everybody. What I did in my own exam, that I marked the answer as heart rate more than 100. I marked it heart rate more than 100 because at the point of time, at the point of the exam, I thought that probably the examiner has forgot to write the accept in this particular question, and that is why the question has been prepared. And by the grace of God, I got rank 1 in that particular exam. Why I am telling you this point is that because when I was discussing this paper next year with my juniors, and many of the people told me that yeah, probably that's the right way of thinking. All that I want to say that my thought process might be correct, my thought process might not be correct at that point of time. Don't worry about them. I always believe that just 2 questions out of 200 will not make much difference. Every question is important. I'm not saying that every question is not important. Every question is important. But if a question is not properly framed, it can never decide your rank. Don't worry about them. It is same for everybody. Focus all your energy on those 198 questions which were properly framed. Focus your energy on that what you will do if NEET will also give the video based questions. Okay, so we are working on that, and we will try to take care of that before the NEET exam, that what if the NEET will also change the pattern. See, whatever I say, that NEET will give you the image based, video based question, NEET will not give the video based, all these are predictions which may be right or may not be right, but ultimately we all have to be prepared with all possible scenarios. Okay, so that is all, friends. Do let us know if there are more things that we can add to that, and in the few due course of time, few days, we will be adding all the subjects to that for the benefit, not just for the answers for the AIIMS, more important for your next big battle that is left with you, and that is NEET in the January. All the best.